Welcome all to the world of Narayana Health City. Today, on 28th July, we have come here to speak on World Hepatitis Day. I am Dr. Manu, the perioperative physician, Liver Transplant Department, and with us we have two of our main faculties, Dr. Ravi Kiran, consultant hepatologist, as well as Dr. Vinay, consultant hepatologist from the Department of Hepatology and Liver Transplant, Mazumdar Shah Medical Center. Today, being the World Hepatitis Day, I would like to ask Dr. Vinay, why do we have a separate day called as a World Hepatitis Day, and that on 28th July?
This World Hepatitis Day is actually celebrated or organized by WHO on every 28th July of every year. This year, they have come up with a motto that hepatitis can't wait. And why is very important is this hepatitis is a silent killer, and in the world, many patients are affected with these, and many of them are not diagnosed properly or not diagnosed at a particular time, so that they land up in complications and leading to cirrhosis and further problems. So it's very important to create awareness among the people about this scourging epidemic or pandemic, epidemic we can call as hepatitis. Hepatitis, as we know, is inflammation of liver. So anything which is causing trouble to liver may ultimately lead and cause problems in the form of cirrhosis and liver failure. So that's the importance of this World Hepatitis Day.
Okay, Dr. Vinay, but we have heard there are a lot of hepatitis A, B, C, and E. So, can you just say what is hepatitis A and what are the symptoms what patients have, and how do they need to change their lifestyle to avoid it?
As you said, there are a number of viruses which can cause liver problems. These are viruses which affect particularly liver. So this, as you said, can be of five types: A, B, C, D, E, and one among them is hepatitis A, which is quite common in a population or in people who are not having adequate water resources, which is hygienic. Usually, hepatitis A is transmitted through foodborne disease, and it is transmitted from one infected person to another person when the water or any other resource gets contaminated. So, hepatitis A is one of the foodborne disease, so that's how we can prevent it. So, for further, I would request Dr. Ravi Kiran to say elaborate about the symptoms and how we can prevent the hepatitis A infection.
Thanks, Manu, for kind introduction, and thanks, Vinay, for your brief on World Hepatitis Day. So, regarding coming to hepatitis A is infection which is acute. Most commonly, it is acutely presented. Patients come up with sort of jaundice, and it is most common hepatitis infection. Most common route of infection is by using contaminated foodstuff and contaminated water. There is per se no treatment for hepatitis A. What we do is when the patient comes to us with jaundice, and if the patient is known to be positive for hepatitis A, we give symptomatic treatment, we give hepatoprotective drugs. But what people should take into notice is that hepatitis A, though it is not fatal, around 1 to 5% of the people can have very severe hepatitis A, which can lead to acute liver failure. These are the people which they have to have a very fast consultation with hepatologist, so that this acute liver failure can be prevented. And if acute liver failure truly happens to that unfortunate person, he can be treated in ICU, and we have a plan of treatment for hepatitis A. So, though hepatitis A is an acute disease, it can be treated symptomatically, and it resolves on its own. Those sort of small minority of people should come to the doctor's notice at appropriate time.
Okay, Dr. Vinay, there is something known as hepatitis B, right? And people say it is transmitted via blood. So, what is the prevalence of this hepatitis B, and how does it get transmitted?
See, hepatitis B is one of the commonest virus infection which is affecting liver in India. Almost in worldwide, there are more than 1 million people who get affected with liver and with hepatitis, and subsequently cause death in them. In India, prevalence is around 3% of patients or population can be HBsAg, that is a marker of hepatitis B positive in them. So, but overall, many patients who have hepatitis B may not be knowing that they are carrying the disease and may not be diagnosed until late. So, it is very hard to know the exact prevalence, but it might be around somewhere around 3 to 3.5 percentage. So, coming to patients who are at risk for getting hepatitis B infections, are those usually it is quite common in those patients who either have a history of drug abuse with usage of needles with infected person, or it could be a contact with a person in the form of unprotected sex who is a positive patient. So, third, it could be spreading from mother to child at the time of birth, and this can be easily prevented at the later stage as we speak with vaccination to the child adequately. And other modes which can transmit is through blood and blood products if it is infected and it is not properly collected, and it is transfused to a person who is negative, can become positive the blood contains that virus.
Okay. So, regarding hepatitis B, Dr. Ravi, how is hepatitis B diagnosed, as well as what might be the signs and symptoms of the patient? And does all patients who get hepatitis B need a treatment? Can you please brief on it?
Yeah, that's a good question actually. Dr. Vinay has already elaborated about how hepatitis B spreads. Most common transmission is from mother to child. Okay, so if mother is found to be hepatitis B positive and she has certain characteristics where the transmission is known to happen in the child, so the newborn baby will definitely acquire hepatitis B. So that is the beauty of this year's World Hepatitis Day theme, that is hepatitis can't wait. So we have to proactively search for hepatitis B virus patients, hepatitis B carriers, not necessarily that they will come to a doctor with symptoms. Unfortunately, by the time people with hepatitis B come to doctor, already the damage has already been done. So hepatitis can't wait. So we have to check the newborn baby. Before that, we have to check the pregnant woman for hepatitis B. And because India is sort of an endemic country for hepatitis B, India caters for more than 30% of burden of hepatitis B, and it includes Southeast Asia per se. So the burden of hepatitis B is real, and we need to proactively go search for hepatitis B carriers and also the patients. As far as your question is concerned, see, the few people would get regular health checkups, right? So they do liver function test, they do ultrasound, and something comes up which is abnormal. And when we chase those reports, then we find that patient is already having hepatitis B. Mind you, when already there is some abnormality even in the liver function test or in the ultrasound, the damage has already been done. So it's our duty that we have to screen all those patients, especially the high risk, as Dr. Vinay told, high risk population, see that if the patient is hepatitis B or not, and whether that patient who is having hepatitis B requires the treatment or not. So most commonly what we see is there are two or three scenarios when we diagnose patient with hepatitis B. So patient comes to us with sort of advanced liver disease, where patient has jaundice, patient has fluid in the belly, patient has blood vomiting. So already that patient is having advanced disease, and we tend to rule out why the disease is caused. So we will do a panel of tests. In that, hepatitis B can come positive. The other set of scenario is patient will come to you with a sort of a lesion in his liver. Then again, we will see why this patient has that lesion in the liver, that cancer. Then we see that unfortunately patient is hepatitis B positive, which has been there since long time and not noticed. The other sort of patients, what we do see is that the patient comes to us with abnormal liver function test. So when we do a test to know why that liver function is deranged, then these patients can have that hepatitis B positive. What people should also do is that what we do, what is called as a family screening. If a person in a family is known to be hepatitis B positive, it is imperative or it is very important for the family and also the doctors to make sure that the next two family members are screened for hepatitis B. And people are scared to get it tested. But if you see the risk benefits, it's always better to know whether the patient or whether the family member is hepatitis B positive or not, because by treating it or by knowing it, we can prevent a lot of complications in the future.
Okay.
That answers the question.
Yes, that answers the question. But I have a doubt. Do we have any vaccine for prevention of hepatitis B? And is it so efficacious?
Yeah, actually, the World Hepatitis Day, as Dr. Vinay said, is observed on 28 July. Why? Because it is birthday of Dr. Bloomberg, who discovered hepatitis B, and he discovered the vaccination for hepatitis B. So it is hepatitis B day in that way, right? So the vaccination, you see that this COVID times, there are hundreds of vaccines. We don't know what is the efficacy of those vaccines. And you take any virus, we don't find a vaccine which is so efficacious. But for hepatitis B, you can say that it is one of the best vaccines the medicine has invented. So there is a very beautiful and very effective vaccine which is available for hepatitis B, and it has already been in our what do you call immunization schedule for the kids. So that is given in 3 doses. Generally, we give at day 0, after a month, and after 6 months, and in people who have immunocompromised, say patients who are having kidney disease, who are on maintenance hemodialysis, they get the double dose of hepatitis B. So hepatitis B has very good vaccination against it. So if what we generally do is that when a person comes with hepatitis B positive report, we screen the patients, screen the family people for hepatitis B. If they are not hepatitis B positive, we advise them to get vaccinated. Yeah, hepatitis B has a very good vaccine, unlike for other viruses.
So, vaccine, by just taking vaccine, they are preventing so many things. One, liver getting affected. Second, to prevent cirrhosis. Third, as Dr. Ravi Kiran has said, it also prevents the occurrence of liver cancers in them. So, it's one way, a single shot for so many problems. So, you can prevent all these problems in them.
Okay, Dr. Vinay, can you explain to us about hepatitis C, how they spread it, and what are the symptoms?
So, Dr. Manu, hepatitis C is very similar to hepatitis B, transmits from one person to another person in various routes. It's usually a blood-borne infection. Normally, this infection gets transmitted from one person to another person if they have transfusion of unchecked blood for hepatitis C, which is quite rare now because of good screening in the blood bank. Second, it could be through infections from needle prick injuries, which is quite common in healthcare professionals. If the person is not screened for hepatitis C and is having hepatitis C, then can be transmitted to the person who gets that needle stick injury. Or it's quite common in the IV drug abusers who share needles. Fourth, it could be due to unprotected sex or sexual contact with a hepatitis C positive individual. So these are the few number of ways the hepatitis C can get transmitted. Coming to patients, how can we diagnose these patients? See, the hepatitis C symptoms can range from completely asymptomatic to all the way developing jaundice and water in the belly, and subsequently also having cirrhosis at the time of diagnosis. So the presentation can be quite varied. So it's quite imperative that we have to diagnose it early so that we don't allow those patients who are positive with hepatitis C to get into a situation where they have developed cirrhosis. So one way of is usually when the patients are screened for the blood test, if they have abnormality in LFT, one can diagnose hepatitis C by getting a simple blood test of detecting the antibody against the hepatitis C. So that way we can detect the hepatitis C quite early.
Thank you, Dr. Vinay. Now we have a brief idea on hepatitis C. Dr. Ravi, what is the treatment of hepatitis C? And like hepatitis B, do we have a good vaccine against it?
Yeah, before coming to that, hepatitis C, the discovery of hepatitis C, the treatment, the history of hepatitis C is very fascinating. I think if you see what the best medicine or best science can do, that then we have to see for hepatitis C. So since last couple of decades, we have discovered hepatitis C and we have got a very good treatment for hepatitis C. So hepatitis C, as of now, I mean, if you have asked me the same thing of hepatitis C many years ago, then hepatitis C was like such a scary disease. Now we have such a good treatment for hepatitis C. Just pop up a pill a day for 12 weeks to 24 weeks, depending on the severity. Hepatitis C is gone. So, I mean, hepatitis C, yes. I mean, when the disease was new, when the discovery was new, there was a lot of apprehension regarding the treatment of hepatitis C. It was only treated with interferons, which obviously had a lot of side effects. Since last many years, there are many drugs for hepatitis C. As I told you, if the patient is not having liver disease due to hepatitis C, we give it for 12 weeks. And if the patient is having already liver disease, then we see and give it still at 12 weeks, but can extend it to 24 weeks. Hepatitis C has various strains. Say, I mean, it's not only one hepatitis virus. There are a few hepatitis C viruses. Initially, we used to have different treatment for different types of hepatitis C viruses. Now the drugs are so good that they are pan-genotypic, what we say. Yes, I mean, hepatitis C has a very good drug for the treatment. Again, unfortunately, we don't have vaccine for hepatitis C. But having said that, because the treatment in itself is so good, the vaccination may not matter as much as it matters for hepatitis B. I mean, hope that we get a vaccination in the future, but as of now, vaccination for hepatitis C is not available.
Okay.
Just in brief, if you see, as doctor said, hepatitis C is one of the bloodborne infection, and it can be easily preventable with adequate care of preventing it, and diagnosing it early is very important so that we don't end up in cirrhosis. And it also has a high risk for cancer, and it can be prevented too. And as Dr. Ravi Kiran sir has said that it can be easily treated with pills easily for about 12 to 24 weeks, and one can get rid of hepatitis C infection in the body and thus become almost virus-free for entire life.
Okay, Dr. Vinay. So you said there are different type of hepatitis, and the last one is hepatitis E. Is hepatitis E as common as A, B? So can you just brief on what is hepatitis E, its treatment, what are the symptoms, and how to prevent those?
See, Dr. Manu, like hepatitis A, hepatitis E is also quite commonly spread from one person to another person through contaminated food and water. So it's quite common in our country, especially it occurs in clusters or epidemic when the rainy season happens or something during that period. So the main route of transmission is foodborne, and it can also transmit through contaminated water. So the best way of preventing it is obviously to have a hygienic food and to practice hygiene and practices in our lifestyle so that we can prevent this disease. Now, as hepatitis A, hepatitis E also affects liver, and it can be in most patients asymptomatic. So maybe a patient might develop some amount of fever or malaise or weakness, but he may not develop jaundice. Once a jaundice occurs, maybe on evaluation might be positive for hepatitis E. But if you see, it is not all the patients will have a problem. Many will resolve over next 2 or 3 weeks. So only few patients, especially the pregnant ladies and kids, they should be careful, especially pregnant women. If they contract hepatitis E, the mortality is slightly on a higher side. So those patients need adequate care and maybe consultation with a physician regularly so that to identify the occurrence of liver failure or to just prevent it. So once you need not panic. Asymptomatic treatments in the form of adequate hydration, good nutritious food will definitely help them to survive that illness. And if there is any problem in the form of increasing jaundice or developing generalized weakness which is not improving, then one person may have to contact the hepatologist or the physician for next set of adequate care. And once the symptoms are improved, usually the patient becomes becomes virus free for the life, and they develop antibodies so that the second or third infection may not happen to them. So in just this hepatitis E virus is a foodborne virus, and it can be prevented adequately with good hygienic practices.
Okay, great. So now we have heard about multiple types of hepatitis, their prevention treatment. But the question everybody has is, does all hepatitis patients need a transplant? So Dr. Ravi Kiran, can you just brief on it? Whether all patients who contract a disease or hepatitis get jaundice and whether they end up in transplant or not?
Yeah, I mean, till now, what we have learned is that there are few hepatitis viruses: hepatitis A, B, C, and E. In these four, hepatitis A and hepatitis E, they present acutely. Hepatitis C and hepatitis B, in generally, they present in a longer duration. Having said that, hepatitis B and C can also at times present acutely, but more commonly hepatitis A and hepatitis E, they present acutely with jaundice, and they sort of controlled by our own body in some time. So once the patient develops jaundice, peak jaundice, in next 2 or 3 weeks, the jaundice settles down. Okay. So these sort of patients will never go for the transplant. Having said that, as I told you in my initial comments, there are certain set of patients in hepatitis A and hepatitis E where the liver is damaged extensively, and these sort of patients will require liver transplantation at some point of time. Even if not for the transplantation, these sort of patients should be taken care in ICU so that they don't progress very rapidly for the transplantation. Yes, hepatitis A and hepatitis E virus infected patients should have a consultation with the doctors to make sure that the jaundice is not spreading faster. And if it is spreading faster, your doctor or primary physician will refer you to the higher center where the facilities for ICU and transplantation is there. There is no need to panic if you have hepatitis A or hepatitis C because it's always controlled with protection. Coming to hepatitis B and hepatitis C, as I told you before, only small segment of the patients will present to you acutely. If there is an acute presentation, the chances are that it goes to chronicity in most of the times, hepatitis C in particular. When it goes into the chronicity, the chances are that it damages the liver slowly. So after a couple of years, after many years, say a decade or so, it can cause liver failure. Liver failure, it can manifest in the form of accumulation of fluid in the belly, swelling of the feet, vomiting of the blood. So these are all the signs where we say that liver has failed and liver is not compensating for the damage. The aim of World Hepatitis Day is to prevent the progression of the hepatitis virus to this extent where it has already caused irreversible damage to the liver. So once the patient has already gone into that sort of irreversible damage, unfortunately, the transplantation is the only option for the long-time survival. Because of rapid strides in the technology of liver transplantation, I mean, we should be happy that yes, even if the patient comes to us to the later stage, we have something to offer to them so that the long-term survival is still there. Having said that, not all the patients with hepatitis B and hepatitis C requires transplant. If we treat them at an appropriate stage, we can prevent the progression of the disease and obviously prevent the liver transplantation. Yes.
So Dr. Ravi, in this day, this 28th July, the World Hepatitis Day, what will be your message to our audience?
I mean, this World Hepatitis Day theme has struck me because, hepatitis can't wait. I mean, since last 2 years, everything is COVID. and we think that hepatitis can wait. Can it really wait is the question. No, it doesn't wait. Still, overall, the global burden of hepatitis is huge. I mean, it keeps on progressive. The disease keeps on progressing. If the COVID is there, if the COVID is not there, it doesn't matter for hepatitis. Still, a lot of lives are lost due to hepatitis. So hepatitis can't wait. It can't wait that it progress. So we have to go aggressively to test for this. As we have discussed since last few minutes, hepatitis A, B, C, E, these are known to the mankind since many decades now. There are good treatment options available. World Health Organization has recognized what is the global burden of hepatitis, and we have not only the doctors, the population in general, the policymakers, everyone has to be aware about the hepatitis, the economic burden and the emotional burden it's causing on the humankind. And it is imperative that we have to stop the progression of the hepatitis, especially because we have a very good vaccination and very good treatment available. Yeah.
Dr. Ravi Kiran, do you have any particular message for patients who are diagnosed with hepatitis for their treatment as well as for their follow-up?
Yeah. I mean, the people who are already known to be infected with one of the hepatitis viruses, I mean, there is a lot of stigma attached to it, unfortunately. So what I request to the patients and their family members is, please don't be disheartened. We're always there here at Narayana Health to help you. You can reach out to us anytime. If you are unable to come here in person, you can always have a video consultation with us. We will be able to help you out. Who knows that hepatitis virus can be very indolent and you may require only the follow-up rather than the treatment. But please feel free to contact us, and we will see how best we can help you out. Thank you.
Okay. Thank you all for being with us during these times, difficult COVID times. I think a short session has given you an information about the hepatitis, its prevention, and its treatment. I hope it was informative. Thank you. Signing off from Narayana Health City.